Hello everybody, this is Dr. Jeff from The Joint Chiropractically. I have Tyson Jones with us here who does spinopraktic massage. Tyson's going to talk to us a little bit about some of the benefits of spinopraktic massage and some of the ways, some of the unique properties and qualities about it. And Tyson, how long have you been practicing spinopraktic?
So I've been practicing spinopraktic massage for about a year now.
Okay, and you've been a massage therapist for how long?
4 years all up.
4 years, okay. You did remedial massage before then?
I did, yes. I had completed my diploma of remedial massage beforehand and worked in clinics as a remedial massage therapist for a while.
All right, well, the first question is, how is spinopraktic then, what makes it different than like a remedial massage?
Okay, yeah, there's three key differences that I like to mention between spinopraktic massage and remedial massage that I found since practicing it. The first is the duration of the treatment. The average treatment of spinopraktic massage is around 7 to 15 minutes. We will spend longer with the client if we feel that they have an area of concern that needs more work, but otherwise it is a very quick and effective type of treatment. The second key difference is the type of pressure we use, and a lot of my clients in particular has made reference to how it's very similar to Bowen therapy in the way that it pushes with the grain of the muscle, and we push in the same direction that it's working to try and help it with its own function as best as we can.
Yes.
And the last difference that I like to mention is our work with the multifidus. The multifidus, of course, being a very thin, fleshy muscle that lives in between, in the little grooves that are on either side of the spine. And it is a really important muscle in terms of stabilizing all the vertebrae and making sure it's sitting in the correct place. So in spinopraktic, we believe it's very important to work with this muscle, whereas most remedial massage therapists you find will not work with that tissue.
Right. Interesting. Okay. So it doesn't take long to do, 7 to 15 minutes. So you're staying pretty focused then on particular muscle groups that are going to...
Yeah, of course. When we're palpating, you'll feel the areas that are just have completely seized up or are staying in that one position and stopping one of the vertebrae from moving. Because when muscles lock up, they're not pulling bones out of place, they're trying to stabilize it, but there's other factors coming into play that's stopping it from doing its job correctly, and that's why we get in there and push with it to help it with the function it's supposed to do.
Excellent. All right, so you're just going with what the muscle wants then.
That's right, yeah.
Right, okay. So what are some of the main benefits that you find with this type of massage?
It holds a lot of benefits that you will get from remedial massage as well, such as helping relieve a lot of pressures and pains that you may be getting from muscles pulling too hard or not pulling enough. But one of the main things that spinopraktic does that I find is not so much of a benefit in remedial massage is our work with atrophied muscles. So muscles will atrophy or break down when they are so overworked that they just can't do what they're supposed to anymore.
Sure.
So they need some time to rest. They need some time to build the tissue again and get back to its maximum strength and do what it does best.
Yeah.
So when we're working with the atrophied muscles, the ones that have broken down tissue, we're getting right in there and we're giving it more blood and helping it build the tissue back again, which people will notice instantly because it may start in very rare cases as a bit of an ache because it has been deactivated for so long.
Sure.
But what we're doing is trying to stop the body from overcompensating and using some muscles more than another. So if you have a pain in your middle back there and that's atrophied and it's causing this to work harder for it, we don't want that to happen. So when we're building tissue back here, it's going to make everything work together as one well again.
Right. Makes a lot of sense.
Yeah.
Yeah, cool. All right, now, you've been working with chiropractors, working with myself. What benefits do you see for conjunction? What are the big pluses when working with a chiropractor?
So a huge thing that I've noticed with yourself as well as Dr. Robert Adams over at First Choice, something that you both have said in common with me when treating one of your patients that has gone to get spinopraktic massage is noticing how much easier it is to move the vertebrae when the muscles aren't fighting against your movements, and also in turn of that, how the treatment is a lot more effective in most cases because you're able to get more of a movement through it. The vertebrae are cooperating to your movements more because the muscles aren't fighting back. They're not causing pressures that are setting you back or making your job harder. So when you're 100% focused on being able to do what you do without having the other interruptions of the tight muscles, then everything sort of falls into place a lot easier. You're able to get into the areas that need it the most, and you're not distracted by those little muscle pulls.
Now here's a question. Do you notice comparing someone who sees a chiropractor and you at the same time versus someone who just sees you, right, for the massage? Do you see the two, do you see any difference in how people respond?
Oh, definitely. When we treat someone and they're not getting chiropractic adjustments, we can still feel the benefits of the muscles that are stabilizing the spine, but they're obviously not getting much of a change in the spine itself. So in very rare cases when you move the multifidus and all of the stabilizing muscles, some points of the spine will move back into the correct place, but chiropractic is that push you really need to get the spine in its entirety back into right health. If you've got an area that's aching the most, we can help that, but we're not going to be able to stabilize the whole spine by ourselves. So that's why it works so well with each other.
You know, I find it works tremendously well. I've worked with other massage therapists in the past who've done great work. But this particular technique seems to be really, really well designed in going hand in hand with chiropractic adjustments. Some of those where people who are really tight and you have a difficult time adjusting, it makes it a whole lot easier. And people tend to respond more quickly. So, Tyson, excellent, thank you. Now you're located, you're here on Mondays all day, and then also on Saturdays.
Yep.
And you also work up at Chermside, you said?
Yeah, up at First Choice Chiropractic from Tuesday through to Friday.
Cool. All right. So Tyson Jones does spinopraktic massage. It's fabulous. I'm Dr. Jeff from The Joint Chiropractic Clinic. Keep your spines adjusted. Check him out. He does his first workup on you at no charge. And I want to thank everybody for watching this video. Have a great day.
Thank you very much.